Hello everyone, this is Al, your Medicare Maniac, going over several topics in this presentation: cardiac rehabilitation, occupational therapy, physical therapy, pulmonary therapy, speech and language pathology services. Now, in the Medicare and You book, all these services are on different pages, but I chose to put them all together because normally when you're looking at insurance plans, they're all grouped all together. So I want you to notice when I start this presentation, we're starting with page 32 for the cardiac rehabilitation, and the next page, it'll have the page number on the item I'm talking about. So please look at the page numbers at the top right or the top left, and I'll make sure to mention the page numbers we are on. So starting here on page 32 of cardiac rehabilitation, Medicare covers comprehensive cardiac rehabilitation programs that include exercise, education, and counseling for patients who meet at least one of these conditions: heart attack in the last 12 months, coronary artery bypass surgery, current stable angina pectoris chest pain, a heart valve repair or replacement, a coronary angioplasty, a medical procedure used to open a blocked artery, or coronary stenting, a procedure used to keep an artery open, a heart or heart-lung transplant, stable chronic heart failure. Medicare also covers intensive cardiac rehabilitation programs that are typically more rigorous or more intense than regular cardiac rehabilitation programs. Services are covered in a doctor's office or hospital outpatient setting. You pay 20% of the Medicare approved amount if you get the services in a doctor's office. In a hospital outpatient setting, you also pay the hospital a co-payment. The Part B deductible applies. Now, let's move on to occupational therapy. This is found on page 42 of the Medicare and You book. Medicare covers evaluation and treatment to help you perform activities of daily living, like dressing and bathing, to maintain current capabilities or slow decline when your doctor or other healthcare provider certifies you need it. You pay 20% of the Medicare approved amount, and the Part B deductible applies. Next topic is on page 43. Turn to page 43. Physical therapy. Medicare covers evaluation and treatment for injuries and disease that change your ability to function or to maintain current function or slow decline. When your doctor or other healthcare provider certifies your need for it, you pay 20% of the Medicare approved amount, and the Part B deductible applies. Continuing on. Now we're on page 45, pulmonary rehabilitation. Medicare covers a comprehensive pulmonary rehabilitation program if you have a moderate to very severe chronic obstructive pulmonary disease, COPD, and have a referral from the doctor treating this chronic respiratory disease. You pay 20% of the Medicare approved amount if you get the service in a doctor's office. You must also pay the hospital a co-payment per session if you get the service in a hospital outpatient setting. The Part B deductible always applies if you have not met it. Now turn the page. We're on page 46 under speech language pathology services. Medicare covers evaluation and treatment to regain and strengthen speech and language skills, including cognitive and swallowing skills, or to maintain current function or slow decline. When your doctor or other healthcare provider certifies you need it, you pay 20% of the Medicare approved amount, and the Part B deductible applies. That concludes this portion of our training under cardiac rehabilitation, occupational therapy, physical therapy, pulmonary rehab, and speech and language pathology services. Thank you very much for your time. Have a great day.